Welcome to the Veterinary Rehabilitation Podcast, where we aim to help fellow veterinary rehab therapists increase their knowledge and elevate their practice. I'm Megan Kelly.
And I'm Ashleigh Lloyd. Together, we bring you the latest insights, research, and information in the field of veterinary rehabilitation.
This podcast is brought to you by Onlinepethealth, a leading continuing education membership for veterinary rehabilitation therapists. With Onlinepethealth, you'll have access to a wide range of online resources to help you stay up to date with the latest techniques, advances, and trends in the industry.
Our podcast features in-depth conversations with leading experts in veterinary rehabilitation. They share their own experiences and knowledge to help you improve your practice. Whether you're a seasoned pro or just starting out in the field, our goal is to provide you with the tools and the insights you need to succeed.
So join us as we explore the exciting world of veterinary rehabilitation and help you take your practice to the next level. Hey Vet Rehabbers, the Vet Rehab Summit this last weekend was unbelievable. If you couldn't make it, you missed out on 2 days filled with invaluable learning focusing on myofascia and myofascial kinetic chains. The content presented by Rika and Vibka was really amazing. I now feel like I have gained a comprehensive understanding of fascia, its relevance to my patients, their symptoms, and my treatment approach. Now, if you're a mobile vet rehabber, you've got a great way that you can listen to the 30 days of recording. You can stream the recordings on your phone and listen to the audio while you're driving. Guys, you have got 30 days access to the recordings. On the 10th of December, that's when your access will end. So please make sure you log in, go listen to those recordings, and download your certificate. So mobile vet rehabbers, you've got no excuses because you guys have got lots of time while you're driving. If you are a mobile vet rehabber, I've also created a really great download, which you might be interested in. It's called Giving Your Mobile Practice Wings. You can go to onlinepethealth.com/mobile to download that. So back to the Vet Rehab Summit. This is our annual online veterinary rehabilitation conference. So this year, it was on the 10th and 11th of November, this last weekend. Next year's dates, you can bookmark them now. They're going to be a little bit earlier in the year. It's going to be on the 31st of August. Now, the reason for the change in the time is that we didn't want to clash with the IABRPT conference, which is going to be hosted in 2024 in my hometown, Cape Town in South Africa. And this is going to be at the end of October, early November. So it's very close, like sort of a week before or 2 weeks before our normal date for our Vet Rehab Summit. Now, both Ashleigh and I are on the organizing committee of this IABRPT conference, and both of us will be lecturing at the event. So not to put too much pressure on the team and ourselves, we decided to move our Vet Rehab Summit a little bit earlier. So 31st of August, guys, bookmark that date. So today, Ashleigh Fairfield is going to join Ashleigh, and they're going to discuss the use of sedation and anesthesia in rehab patients. They discuss some of the patients we may want to use this for, the procedures that need to be in place before starting, and how sedation may impact the mental state and experience of a patient, reducing fear and potentially actually improving sometimes their experience. So before we head over to that chat, a quick word from our sponsors. Choosing the right therapy laser and PMF system for your practice are big decisions, and that's why Response Systems has been helping to make that decision easier for over 35 years by offering both Class 3B and Class 4 lasers, as well as a full line of PMF products designed for both small animals and horses. All of their systems are fully rechargeable and adapted for international grids, and you can find out more at responsesystem.com. Right, over to my chat with Ashleigh and Ashleigh.
Hi guys and welcome. Hi Ashleigh, thank you so much for joining me.
Hi, thank you so much for having me.
Awesome. So today we are going to be chatting about anesthesia and sedation in rehab practice, which is a very interesting subject and something that I know nothing about. So I'm really looking forward to learning some stuff today. All right, Ashleigh, so please tell us a little bit about yourself and your interest in our subject today.
Awesome. Well, hi everyone. Sorry, my voice is a little froggy. Thank you so much for coming and discussing one of my favorite topics with me. As Anna mentioned, my name is Ashleigh Fairfield. I am a veterinary technician and rehab practitioner in the US. And I've been working in the veterinary field for almost 20 years now. And over this time, I've landed in many different areas of veterinary medicine, primary care, emergency, surgery. But ultimately, I found my biggest passion in the disciplines of physical rehabilitation and pain management. Over my career, I've also had the opportunity to mentor many veterinary technicians, assistants, and veterinarians, and this has helped me to discover another one of my passions, which is teaching. And most recently, I started a veterinary technician relief company and consulting company that allows me to educate on a much, much larger scale, which I really, really love. And I especially love spreading the word of what we all know physical rehabilitation can accomplish. But today I wanted to focus a little bit on the anesthesia side and talk about strategies that can improve the processes of sedation and anesthesia in our rehab population.
All right, so super interesting subject. And this is actually a subject that Meg has been kind of pushing me for a while to discuss. So I'm really excited yeah, for sure. It's one that I've pushed against a little bit because, like I say, I really know nothing about sedation and anesthesia, and I've never incorporated it into my work with my patients. So I'm very keen to learn today how we could be incorporating it, and where those opportunities lie. So tell us a little bit more, maybe before we get started, there are others like me. What is the difference between sedation and anesthesia so that we're just on the same page?
So I think that everybody has this, all anesthetists have their own spectrum of what they consider to be anesthesia or versus a heavily sedated patient. But the technical definition is that a patient is considered anesthetized when they have a full loss of consciousness. And when training, I have encountered this assumption that sedation is inherently safer than anesthesia. But one of the things that I wanted to really do during this talk was to challenge this idea that heavy sedation is better for the patient or easier for the patient to tolerate than general anesthesia.
Okay, so it's actually not like a black and white thing, as you say.
Yeah,
different people will have a different kind of view on where that line is. That's super interesting. All right.
Yeah.
So what is?
Oh, go ahead.
No, go talk more about heavy sedation.
Yeah. So heavy sedation, it's not going to be suitable for all patients. And there have even been studies that suggest heavy sedation may increase the odds of anesthesia-related death when compared to general anesthesia. So not to discourage heavy sedation versus anesthesia, but I just one of the things I wanted to touch on was that the decision between choosing the two is going to be really nuanced, and it's helpful to think of each patient as an individual.
Okay. Like everything that we do. I love that. All right, good. So what has your experience been when it comes to bringing those two things together, sedation and anesthesia and rehabilitation?
Yeah, so my role as a relief technician and consultant has exposed me to a variety of ways sedation and anesthesia can be incorporated into the rehab setting. So we know it's not uncommon for our rehab patients to require therapies that no patient would tolerate while they were awake. Things like an arthrocentesis or a joint injection or prolotherapy or shockwave therapy. And again, I found that because these procedures are often quick, there is this misconception that the procedure is safer, and that sense of quick and safe may lead to inadequate preparation for any complications if they were to occur. So today I wanted to talk about some simple strategies that we can incorporate to improve the process of sedation and anesthesia in our rehab population.
Okay, I love that. All right, so talk to us a little bit about safety considerations and how we can make sure that, we're preparing properly.
Yeah, so again, it starts with deciding whether we want to apply heavy sedation versus general anesthesia. So when we're making that decision, really, again, considering the patient as an individual and considering the patient's medical history, their physical exam, maybe any pertinent recent diagnostics. And then I think something that gets really underlooked is in selection of drugs or in sedation versus general anesthesia is what that patient's temperament and fear, anxiety, and stress level is, because that's going to definitely impact how effective the cocktail that you choose is going to be. And then also considering the procedure to be performed, how invasive is the procedure, how painful is the procedure, will it exacerbate any existing pain, even just like the positioning for that procedure. Maybe they have a comorbidity that is completely unrelated to what they're being sedated or anesthetized for today, but that positioning could aggravate whatever is uncomfortable for them additionally. And then how imperative is it that that patient is immobilized? Is it something that they can be a little bit awake for, and we just need to improve their tolerance? Or is it really imperative that they are very, very still and very, very asleep? And then regardless of whether we choose heavy sedation or anesthesia, I really want to drive home that I like to prepare for them as if they were the same. So even if I'm not expecting a patient to require to be intubated or to require to be put on a vaporizer or have oxygen or be hooked up to the anesthetic machine, I like to have everything ready as if I were to do those, because things can quickly change. And something that, we expected to be very quick and routine can very easily become something that we need to convert to a full general anesthesia. So having that preparation is going to make everybody's life easier. So again, just this mantra that preparation is key, because even the most routine anesthetic event can become quickly stressful in the presence of an anesthetic complication. And maybe that complication isn't even, that significant, but any sort of stress and anxiety can make it hard to evaluate the risk, weigh our options, and implement speedy action, which is going to impact how well our patient does under the influence of these drugs. So timely assessment and intervention can be critical during an anesthetic complication or crisis. So having a proactive approach to any potential complications can decrease our anxiety as anesthetist and then improve efficiency if a crisis were to occur. And then again, I do like to prepare for both of these events in the same manner.
I really love that you've said it that way, because it makes, like you've said, your mental state and your stress level when things go wrong, if things go wrong, you're just in a much better position to respond instead of reacting. When you've prepared yourself for as many scenarios as possible, you can make the best decisions for that patient. So I really love that perspective and that thinking, because like you say, you're not really going into an emergency scenario, but if something were to happen, how well can you react and can you respond to that to the benefit of the patient? So I really love that. Do you want to talk more about that preparation procedure?
Yeah. And I love what you said too. We never expect for there to be an emergency. But I mean, over my career doing anesthesia, there are patients that you expect to be really routine. And then very quickly that can become something that, you didn't anticipate a complication. So if we have our ducks in a row and we have that muscle memory of, okay, I know that all of my equipment is here. It's readily available to me. I can implement action much more quickly and much more effectively.
I like that.
So I think the best place to start is an anesthesia safety checklist. And for those who are unfamiliar, these checklists are going to prompt the anesthetist to confirm that specific anesthetic safety procedures are performed and provide a legal record for the hospital. And there have been many studies, and even in human medicine, that have shown that checklists can reduce patient risk by preventing these critical mistakes and errors. They're going to prompt you, did I do everything before I put drugs into this patient? An example veterinary anesthesia safety checklists are going to be available. There are many of them, and they're available online for free use and can be tailored to each practice's needs. So you can kind of incorporate them based on what your practice flow is. And I also really want to ensure that all of my equipment is functioning and correctly working before use. And this is going to eliminate the need to troubleshoot any issues during the procedure. Most equipment is going to require regular maintenance, and the anesthetist should be familiar with the manufacturer's recommendations for the equipment that they have in their hospital. Even if you're not planning on using an inhalant for the procedure, I always want to make sure that my anesthesia machine is pressure checked with an appropriate circuit attached, and that any leaks in my circuit are going to be identified and addressed before use. Because again, something that we expect, maybe they only need oxygen supplementation during their heavy sedation, could quickly go to, I need to intubate this patient and I need to maintain them on isoflurane or sevoflurane so that they stay at a better plane. So having that contingency and planning set in place before we get to that point. And then when combined with this previous anesthesia machine pressure test, if we have our endotracheal tubes pulled and then leak tested as well, if we do have to intubate that patient, this is going to eliminate the concern for a leak in our circuit equipment. So we've taken that hiccup off of our plate. We can also verify that the vaporizer has enough inhalant in it and that we have enough oxygen to supplement during the procedure. And then one thing that I think often gets overlooked as well is replacing the CO2 absorbent. And this needs to be replaced if it's been in use for longer than 8 hours. So I've definitely seen where that gets kind of overlooked. I also want to have my multi-parameter monitoring units turned on and inspected for errors and placed in standby mode so that I can very easily attach them to my patient once they're at an appropriate level of sedation. And just making sure that, hey, my capnograph is working, or, I have all my ECG leads attached so I don't have to run over to the inventory area of the hospital to try and replace it. Readying my anesthetic monitoring sheet and having that readily available. This is going to help me record and track important patient information during the procedure. And it's going to provide a detailed record of the patient's anesthetic event. And this monitoring sheet is going to provide the anesthetist and clinician additional context in making treatment decisions, and should be used even for brief procedures. Even if you're only expecting them to be out for a couple of minutes, I want that available because it can show me any trends that I need to take into account. And I really advocate for use of a graphing anesthesia sheet, because this is going to provide a visual representation of anesthesia-related data, making it easier to identify any trends or patterns versus, a written anesthesia sheet where you're kind of just looking at numbers, and it's not going to be as easy for you to say, hey, we're seeing a gradual hypotension, or we're seeing a gradual tachycardia. This monitoring sheet is also going to serve as a legal document in the event of a malpractice claim, which we never want to think about, but it's so nice to have in the event of that occurring, because you have everything documented.
I think that, like you say, we don't want to think about that, but it does happen that a client is unhappy or for whatever reason, and it might just be their perception, and it can be really difficult on us when we're already struggling with our confidence or imposter feelings, where we will immediately jump to, oh my gosh, what did I do wrong? What did I miss? We'll blame ourselves immediately, because that's who we are, right? Absolutely. And if we can go back to those records and say, hey, I didn't do anything wrong. Things happened that are out of the ordinary. I responded appropriately. I did the best that I could. That helps that helps us communicate effectively with the client that's unhappy, but it also helps us to stay accountable to ourselves and to
Exactly.
continue to foster in ourselves a mindset of, I'm going to just say love, because
Yes.
the words are not coming easily to me today, but so that we're not constantly criticizing and judging ourselves super harshly like we do, because we do. Yeah, that we can be a little bit more objective and a little kinder to ourselves. I think
Yeah.
that's so important.
And I really advocate for, even if the sedation or anesthesia was relatively routine, going back and auditing your own
Yeah.
anesthesia records, because we're all learning. I mean, by no means am I an expert on anesthesia. I am going to continue to get as much information as I can over the course of my life on it and everything that I'm interested in. So being able to be like, hey, maybe I should have intervened a little bit sooner, even though, nothing terrible happened, but being able to try to elevate our standard of practice within ourselves routinely too.
I love that. I love that. Good. Okay. I want to ask a little bit more about, when we're deciding whether or not to use this tool within our rehabilitation practices, who are we going to speak to? So, for example, you are in a veterinary practice, right? And you're working together with staff, with the professionals that are using anesthesia and sedation on a regular basis. But for someone like me who is in a separate practice, who's working separately from vets, that's not the right way to say that, but we're not in the same building. We're not necessarily having conversations every day. If there was something that I wanted to do under sedation, who would I be having those conversations with, and what would that preparation kind of look like, to give me an idea of how many people are going to have to be involved from the veterinary staff side, where do we have to do it, those kinds of logistical things, I would say.
Yeah. So I kind of straddle both sides of this because I practice rehab under the supervision of a veterinarian, but am largely seeing patients by myself. And then, but I also work in the same building where any sort of sedations would occur, and will sometimes do those procedures. So it's, in my case, if I have a patient who I think requires some sort of level of sedation for whatever, then I'm going to talk to my clinician and you make an argument for, hey, I need, I really think that this patient needs XYZ. Are you comfortable with performing that? Are you comfortable with this cocktail of drugs to use? And then we kind of collaborate, and ultimately the veterinarian or the overseeing clinician is going to be the one who signs off on that in my case. And then I think I can speak mostly for the US, but it's really going to be dependent on your state's Practice Act on how involved you are with the anesthesia procedure. In the state of Virginia, the licensed veterinary technician has a lot of autonomy with anesthesia and sedation, but the veterinarian is always within reach. So I think it just kind of depends on where you are in the country or the world.
What kind of timeline are we looking at? So you've described quite an intensive preparation procedure. How long does that take you just to prepare? And then for something simple, so let's say I want to do a round of shockwave, what kind of time period are we looking at for the preparation to the procedure, to the recovery, for ourselves and for our patient?
That's a great question, and one that I get a lot, because I get this pushback or argument that, well, this is such a quick procedure. Do I really need to take so much time with preparation? We need to be efficient. We need to be able to get these patients in and out. And I do think that initially it's going to take a little bit longer to develop that muscle memory of like, I need to get all my ducks in a row. So I always, when I'm training, I guess warn who is running the practice, hey, I promise you this is going to be very quick eventually, but we need to take the time to develop that muscle memory so that this can be executed in a quick manner. So when I'm training, I try to give like 20 minutes to go over, pressure checking and getting all of our supplies and making sure the crash cart is well stocked and having emergency drugs calculated. But now, it takes me probably like 3 minutes or so. And especially if you put in processes where everything is kind of in the same place and readily available, and you have these redundancies where, I have this and this and this, and if I overlook something, it's still going to be right here. That's going to be really helpful. So I think ultimately there's no good argument to not prepare, because it's going to take very little time.
Okay. No, I love that. Practice. What is that little saying? Proper preparation prevents poor performance.
I love that. Yeah.
Yeah, that's what it comes down to. Preparing properly is at the end of the day what's going to be the best thing for our patients. So I really like that approach. Thank you for sharing that. So what are some other reasons that you might put a rehab specific patient under sedation? I think in all my time, there's been one where I've said, okay, I think this one we need to do together. And it was a contracture that I wanted to get stretched out. And obviously that's very painful, but without stretching and without, kind of casting in that stretched position, it's very difficult to come back from. So that would be one that I can think of. What are some other ones that you've...
That's a great one. And I've definitely been there. Even just aside from rehabilitation, I think in veterinary medicine, the sedation is kind of underutilized in regards to when you consider the patient experience. So I think it could be as simple as this patient is quite fearful. We haven't developed that rapport that we are very lucky to be able to do in rehab yet, but maybe it's like their first visit, their second visit, and they're terrified and I need to do an exam. Maybe having some moderate to heavy sedation to accommodate that could be helpful. So it could be as simple as, I just want to improve this patient's experience. I do think that the stretching, the contracture one is one that I have done several times, because you're absolutely right. That is quite uncomfortable. Shockwave, depending on what kind of unit, can be really intolerable. And even if you do have a patient who tolerates the shockwave itself, sometimes that noise can be quite scary. And that audiophobia is enough reason for me wanting to administer some sort of sedative. The big ones that I can think of is any sort of arthrocentesis or joint injection, if I'm trying to obtain any diagnostic information on that patient's particular joint or treat that particular joint. I know Synovitin is starting to become quite big in the US, and so they're sedated for that.
You've mentioned fear, because I think you're right. We don't consider this as a tool for us to help overcome that fear enough in our patients. And I think it might be a really good option in some cases. I know we've had a few conversations on introducing horses to the water treadmill, and in some cases sedation is kind of the standard practice. So for some clinics, that first 1 or 2 sessions on the water treadmill is always under sedation, and for others it's sometimes under sedation depending on the horse. So I think that there is something there. How does sedation actually change their experience? Because are they able to still kind of make sense of what is happening around them and amalgamate that memory and that experience into something positive while their fear is just toned down? Like, how exactly does that impact their mental state and what they remember about that experience?
That's a really good question. And I think a difficult one to answer simply, because I think it has so much to do with what drugs or what combination of drugs you choose. For example, if you're using, maybe they're painful and you choose a medication that's a sedative but not an analgesic, they're going to have a much different experience because you haven't addressed that pain portion. So maybe even though they're quite sedated, you think they're having a good experience, they're not having as good of an experience as you think. Versus something like ketamine, which they can look quite awake, but they're so disassociated that they're probably not going to remember much of what has occurred. So I think it can really depend on what cocktail you use. But what I strive for is the appropriate level of sedation or anesthesia for the procedure at hand, while keeping in mind the patient as an individual. So I want them to, if it's something that they can tolerate while they're not completely immobilized or completely recumbent, then I want to assess their fear, anxiety, and stress and make sure that I'm not causing any undue increase in their stress signs.
Okay. Yeah, I mean, that's really interesting to think about, because if you've just said that, if you're addressing, you're giving them something to kind of calm them down, but you're not addressing the pain. And then we're performing a procedure that's extremely painful, or maybe not extremely painful, but is painful, and they don't have the ability to respond to that pain, then that could make the experience far more traumatic for them, right?
Absolutely. Yeah. And even if
you
they're
hear
not
horror stories like that from people who are undergoing some procedure, and then they're kind of like stuck in their bodies. And how would we know with dogs or horses if that was happening, because they don't have the ability to verbalize and share that with us after the fact.
I think it takes an astute observer who is versed in signs of pain. And then even if you have a patient who, let's say they're under, heavy general anesthesia and they're very painful, but we're not administered an appropriate level of analgesia, their body is still going to have a nociceptive response, and they're still going to experience that level of discomfort just without that consciousness. And it's when they start to wake up, they're going to have a rebound effect. So again, just because I'm maybe not having a difficult time anesthetizing them, considering the big picture, because we need to treat all areas of our patient.
Amazing. If you have used anesthesia and or sedation for any of your rehab patients, please let me know. I don't know, is it something that could be relevant when we're using acupuncture in certain cases?
Yeah, absolutely.
Yeah. Okay.
I don't know. So I give the caveat of I'm not exactly sure if it would be contraindicated with the pathways that are utilized with acupuncture. But in my opinion, I would say that anything that allows a patient to be a little bit more relaxed, I would imagine your parasympathetic effect from the acupuncture is going to be enhanced, with the asterisk of fact check that in acupuncture.
Okay, no, I love that one. Maybe you know the answer to that one. Have you used some sedation or anesthesia when you've used acupuncture? It would be good to hear from you.
Yeah.
All right. I think those are kind of all my questions. Is there anything else that you can think of that I haven't asked you, or that you still want to share with our listeners?
The only thing I wanted to end with was specific to our patient population. So often our patients are going to experience multiple orthopedic or neurologic pathologies, and then also, be experiencing chronic pain. And many are geriatric and experiencing age or disease-related muscle wasting. So considering that, this can make anesthetized recumbency uncomfortable or exacerbate existing pain. So I wanted to also underscore that we should really strive to provide good traction, gentle restraint, and for patients that are not amenable to having something done with gentle restraint, then reevaluating what our cocktail is, because they just might need to be less fearful for us to perform what we need to perform. Really nice padding and appropriate positioning with support is really imperative, because we have these, again, maybe we're treating a knee, but they also have hip dysplasia. So considering that maybe our treatment isn't benign to the other things that are going on in their body, and we need to be cognizant of protecting those other areas.
I love that. It's rarely only just one area.
Exactly. Yeah. I know I have multiple joints. I have neck stuff myself. And when I'm under anesthesia for something completely unrelated, I'm like, please keep my neck exactly straight because I don't need any new problems. So again, just I always try to, even if the history seems unimportant or unrelated to the task at hand, keeping that big picture, because our patient is what we're treating might be a piece of a pie, but we need to consider the whole pie.
I love that. Thank you,
Yeah.
Ashleigh.
If you enjoyed this podcast, please hit the subscribe button so you get notified every time I load a new podcast. I'm here every week talking to vet rehab therapists from all over the world about all things vet rehab. A big thanks to our sponsor, Response System. Their sponsorship allows us to be able to give this podcast out to you for free. So go and check them out. You can go to responsesystem.com. For more information about continuing education for vet rehabbers, you can go to onlinepethealth.com.